Story 1. I was at a lecture a couple of years ago given by two doctors who had undergone treatment for breast cancer and written a book about it together. I remember one of them talking about her diagnosis. She was a breast cancer surgeon herself, you could not make it up. She walked into the consultation, saw her scans, and her heart dropped. She barely heard a word the doctor said because she could not stop the flood of information. Looking at the scans, she knew whether she would need surgery, chemotherapy, radiation therapy, how long it would take, and what her estimated survival was. I do not think they treated it like a group project, but she could not stop listening to her internal monologue since it was her specialty. I remember her saying she had found it, in hindsight, an incredible learning opportunity about how to interact with patients, and that she thought about it a lot. Story 2. It depends on what I am going in for. As background, I am an oncologist and I trained in internal medicine previously. For most internal medicine issues, I do not go in unless I need something I cannot easily obtain for myself, for example labs or imaging. For specialty areas in which I was not trained, I go in, give the best history I can, and let them manage the rest. Story 3. I don't get involved in management. I let the doctor seeing me lead unless they miss something major, in which case I double-check. The main difference is that I can present the whole history and relevant information in about 30 seconds, and the doctor can provide a management plan in about the same time. These are the fastest consultations I have experienced. They are very methodical. Story 4. I am a neurologist. I am not good at going to the doctor. I do not go often, but when I do I usually stay quiet, especially if it is a field of medicine I know little about, such as dermatology. That said, the doctor usually knows I am a physician as well, so the language tends to be more technical. I also find that we practice less defensively with each other since we can be more open. For example, the doctor might say that we could run a set of diagnostic tests, but honestly the most likely diagnosis is this: try this treatment, and if it does not improve then we can run the tests. Story 5. My mom is a general practitioner and usually self-diagnoses, but she sometimes gets a second opinion. She does not typically see another doctor in person. She calls colleagues to consult. Her contacts are filled with all kinds of doctors. It is like a secret underground community. For procedures such as ultrasounds and other imaging, they discuss cases as if it is a group project. Story 6. I hope you consult doctors to get personal answers. Paul Kalanithi addressed this in his book When Breath Becomes Air. Early in his cancer treatment, he was closely involved in decision-making. He described his conversation with his oncologist as a collaboration. Later, she reminded him that he did not have to participate in decisions and could let her be the doctor and focus on himself, which he accepted. Story 7. I'm an emergency department physician, and sometimes I have other doctors as patients. For the most part, they are good patients because they can give a clear description of their symptoms that is useful to me. They ask good questions and are well-equipped to have informed discussions about diagnosis and treatment. Sometimes it is hard for me to dial back my habit of simplifying medical terms for laypeople. It can be challenging when their specialty is unrelated to the problem and they do not recognize the limits of their understanding. The worst patients are those with only a little medical knowledge who think they know everything. A common example is someone saying their aunt is a nurse and insisting they need whole-body magnetic resonance imaging for a runny nose. As for self-diagnosing, I usually manage my own minor medical issues. If I notice signs of something more serious, I would see another clinician. Story 8. I am a doctor in family medicine. I diagnose myself for most things, but for my 1-year-old daughter, I decided some time ago that I would not do that for her. Her pediatrician does not know I am a doctor. I never told her. I want her to treat me like any other parent and explain everything to me as if I were 5 years old. I am afraid that by being too nonchalant about my daughter's health, I will miss something, or that the doctor will assume I know more than I really do. It is a strategy one have adopted for myself. If I go to a doctor, for example a gynecologist for a routine checkup, I sometimes do not say what I do so I can legitimately ask simple questions about things I should really know. I do this so the other doctor will not leave out important information they assume I know for fear of insulting me. On the other hand, my regular doctors do know, such as the gynecologist who saw me through my pregnancies, and that enables more complex and nuanced discussions about health decisions. including debating questions and giving me options that he would not necessarily discuss with his other patients because he can be sure I understand the medical pros and cons once I have a basic explanation. Story 9. Doctor here. It depends on the medical specialty involved. For example, I do not know much about neurological issues, so if I visited a neurologist, I would not offer input. For more general conditions, I have offered my thoughts to my doctor about what the problem might be. Ultimately, I still see the doctor because they can prescribe medications and order tests that would be difficult or inappropriate for me to arrange myself. Story 10. I am a doctor. In general, people are not good about going to the doctor. For me, I get physicals about half as often as recommended. The last time I had strep throat, a year and a half ago, it did not resolve with the antibiotics I had in my medicine cabinet. When we go in, it feels like a group project. We discuss options together, but ultimately I defer to someone with more expertise who can make an objective decision. Story 11. I sat in on a consultation between two doctors, one of whom needed an ultrasound. They already knew each other through work, so the atmosphere was friendly and casual. The junior doctor was trying to figure out what was on the ultrasound screen, and the senior doctor was teaching him the parts he did not know. Story 12. I just wanted to say thank you for one of the more original AskReddit questions I have seen in quite a while. It is a really interesting subject. Story 13. The pace and density of the conversations are different, I am sure. I am an emergency physician who, over time, has treated various physicians in my community, including internists, surgeons, and radiation oncologists, some affiliated with my hospital and some not. Keep in mind that each specialty is quite different from the others. The radiation oncologist, for example, thinks and speaks differently from the orthopedic surgeon, and I felt that treating each of them was very similar to treating a professor of engineering. Academically minded people tend to ask many questions and do research while you are out of the room, compared with people who prefer a more paternalistic approach and just want you to tell them what to do so they can get on with their day. I am careful to acknowledge that the number of hours that went into my family physician's training is the same as mine. It is simply a different focus. She knows a great deal about management and screening for chronic disease that I do not, and I know how to intubate people, manage a severe lysergic acid diethylamide reaction, or use a jar of bubbles to distinguish between children who are scared and those with head injuries. Story 14. I always go to someone who doesn't know me, and I wouldn't say that I'm a doctor either. My significant other, however, is a doctor, and whenever one of us feels unwell, we discuss it like a group project. He always refuses treatment until his symptoms become very severe. Story 15. Both my parents are doctors and treat each other as their physicians. Because of this, they do not make appointments. If my parents or I get the flu, they simply write a prescription. If they need specialists, they tell them they are doctors and often receive preferential treatment, such as skipping lines, or they already know the specialists, so things are informal. I am sorry this sounds spoiled, but it is my experience. Story 16. Not a doctor, but spouse of a doctor. I thought I might have a ganglion cyst in my wrist because I could feel something inside that was causing pain when I moved my wrist, so I scheduled an appointment with an orthopedic surgeon and hand specialist. I had my husband come along. He is an interventional radiologist and could answer questions I might not think to ask or provide more explanation later. The orthopedic hand surgeon was friendly and used layperson terms with me but technical language with my husband. It was funny to hear the switch between your wrist bones and tendons and technical terms such as anterior and medial when he spoke to my husband. At one point, they performed an ultrasound on my wrist to determine whether it was a cyst or whether I needed a more detailed magnetic resonance imaging scan, and the surgeon asked my husband if he wanted to perform the ultrasound since my husband also trained in diagnostic radiology. He did. It was strange to see him moving the ultrasound probe and pointing to areas that looked like artifact. They both agreed it was a cyst, even though it appeared as mostly artifact to me. It was interesting to see my husband defer to the surgeon for his specialty and the surgeon defer to my husband for radiology. I also remembered when we took our cat for a radiograph because she was developing arthritis and we were not sure how severe it was or whether her bones were deteriorating. My husband took the radiograph and had an attending radiologist read it, and they were both convinced our cat had bone spurs or small bony growths around her spine near her hip. He was about 80% convinced that our cat's spine was severely damaged. The veterinarian was not worried and said that cat bones often look like that and it was not causing her pain. My husband researched feline anatomy to make sure our very knowledgeable veterinarian was not mistaken. She was not. The moral of the story is that he went to medical school to study human anatomy, not feline anatomy, so he had to step back and defer to the expert. Story 17. I try to act like any other patient. Healthcare professionals can harm their own care by taking shortcuts or by avoiding treating their problems the way other patients would. That is a mistake. I have seen harm result. I do not seek care for trivial, self-limiting infections or harmless conditions because I know they will resolve. I do see my regular doctor for problems that bother me and for routine exams like anyone else. It can be stressful to be either the doctor or the patient in these interactions. I have learned not to let it bother me when I am the doctor seeing other doctors. Letting it affect me can be harmful. I also try not to create stress for other doctors who know my role, because that could be detrimental to my care. Story 18. My grandpa was a cardiologist, and he was the worst at knowing when to go to the doctor. As he got older, he developed cardiac arrhythmias but kept saying that everything was fine and that he did not need to be checked. Story 19. My mother is a nurse and never tells the doctors what she does for a living. She does this so they will speak to her not as a nurse but as a patient. Even though she can understand their medical jargon, she does not want them to be overly comfortable using it while treating her. Story 20. As an emergency room doctor, when I see my primary care physician, all decisions are made in tandem, and I have more input on my treatment plan than a layperson. I second what others have said. When I see another physician, such as a specialist, I am more capable of making informed decisions than a layperson but will always defer to their experience and knowledge. 2 examples. 1. I had a primary care physician who jokingly said to a medical student in front of me, "How the hell could he even sue me? He's a doctor." I promptly found a new primary care physician. It is okay to not like a doctor. Doctors sometimes dislike other doctors. 2. I am a doctor with literally tens of thousands of hours of experience saving people's lives. And even I know that I do not know 0.1% of what Anthony Fauci knows. Wear your mask. This is not a debate doctors are having, just morons. Story 21. I had a relative who was an old-fashioned veterinarian and probably the worst patient because of it. He would argue with his doctors about his prescriptions and then order the medications through a veterinary pharmacy because they were significantly cheaper. It made sense. Why pay $50 for a particular medication when he could get the exact same thing for $5? Still, it looked kind of funny when he was in his 80s, hobbling around with heart medications that had, "For dogs only," printed in large letters on the bottle. Story 22. I am a doctor. As someone else said, if I am seeing a specialist in a particular field, I will usually have far less knowledge than they do, so I consult with them like any other patient. If it is something more general and I am seeing a general practitioner, I tell them I am a doctor so they do not give lengthy layperson explanations, but I generally try to have a normal doctor-patient relationship. I might offer an opinion, but ultimately I stay quiet and respect that they are a professional and not tell them how to do their job. It is hard to be objective when the patient is yourself or a family member. Having someone give an unbiased opinion is often more useful than self-diagnosing, or at least can add knowledge or insight you may not have. Story 23. Greatest doctor call of all time. First, paramedic here, not a doctor. Call for chest pain on the side of the road. A man had pulled over to call emergency services. He was not local, just passing through. While my partner, an emergency medical technician, was attaching leads, I was getting some history. The man was clearly well educated, knew his stuff, and spoke the terminology. I ran a 12-lead electrocardiogram. It was bad. Not catastrophic, but we needed to activate the catheterization laboratory and transport rapidly. It was also a little odd. I obtained a 15-lead electrocardiogram and then a right-sided electrocardiogram. The whole time we were en route to the emergency department. The man asked about nitroglycerin, and I explained that certain types of heart attacks can be made much worse with nitroglycerin. He asked to see his strips. I handed them over while calling in my report. He thanked me, said I was right that it was anterior, and said he would need coronary artery bypass grafting. He was a cardiologist. Coolest, most laid-back patient ever, having a heart attack and explaining the surgical procedure he might undergo. Story 24. Forensic pathologist here. I let my doctor do their job. I have a pulse, so I am not the expert. Doctors who treat themselves are scary and arrogant, in my humble opinion. Story 25. I am a neurologist. I assume rare, worst-case scenarios for myself and my loved ones. I rely on doctors. Healthcare has become so specialized that it is not possible to know everything outside your specialty. It is good to ask for help. That said, I am a terrible patient. Story 26. I am a resident. We do not have time to see a doctor for ourselves because hospitals are too busy squeezing more work out of us. Story 27. It is not uncommon for a doctor to self-diagnose and go to a clinic to have someone confirm it so they can obtain prescriptions. However, you are not supposed to diagnose yourself. You should act like any other patient, describe your symptoms, and let the clinician determine your condition. Story 28. I am not a doctor, but I am finishing my Doctor of Medicine degree this year. You do not have to be a healthcare worker for your care to be a collaborative effort between you and your physician. Medicine is inherently collaborative. If you have questions about why a treatment is being given or how you were diagnosed, you should always ask. If your clinician refuses to give reasonable answers aside from "because I said so," ask for a second opinion regarding your care. Because someone may be leading the effort does not mean you should be apathetic about your care. That level of trust is dangerous. You would not rely on a single controller for collaborative projects in high school, and things go better when everyone contributes. Story 29. It is strange to think that Reddit has doctors. I always had the sense that everyone here was an unproductive couch potato. Laughing out loud. Story 30. Can you post this on the Reddit AskDocs community? I would love to see the answers. Story 31. I am a subspecialty surgeon. Most doctors have a basic understanding of general medicine and can have a collaborative discussion with their primary doctor. For more nuanced issues involving referrals and consultations, an informed discussion can still occur. One of the most crucial aspects of being a good physician and surgeon is knowing what you do not know. As with any of my own patients, I will discuss the case but ultimately trust the other subspecialists to practice sound, evidence-based medicine in their area of training. Story 32. I try not to tell them that I am a doctor. I am an anxious patient. I know too much about terrible diagnoses that can change your life in an instant, and I worry about my mortality. It is easier if they do not treat me as a knowledgeable professional but as the irrationally fearful person I am. Story 33. I know I am not the intended target, but I am a registered nurse case manager for a primary care clinic, and going to my primary provider's office as a patient feels funny. Generally, I lose all sense of medical knowledge when my children or I are the patients, perhaps out of panic. I often call the triage advice registered nurse for my children, which I do daily. If my provider asks whether I have any diagnostic requests for my own care, I always tell her, "You are the doctor. I trust your judgment about how much or how little she wants to order." Story 34. I've had a few doctor's appointments since starting residency. I've been enjoying acting like I know nothing about medicine so I can get a good feel for the provider. In reality, if a physician, physician assistant, nurse practitioner, or similar knows they are about to treat another provider, they tend to act more professionally. But, as with my own patients, I hope I'm getting the most honest care from the start without any status attached. Story 35. I am a medical student. When I see a new doctor and they know I am in medical school, it feels like being let into a behind-the-scenes world, and I love it. Some doctors speak to me more like a peer than a patient, explaining differential diagnoses and their reasoning in more detail than they would for patients who are not medical trainees. It is an impressive balance of education and patient care. I appreciate doctors who are welcoming to the next generation. At their core, physicians are educators. It is humbling to be a patient, and it reminds me what it will feel like to be in my future patient's shoes. Story 36. I had a skin condition and saw a dermatologist. We spoke in shorthand. She began to explain a biopsy, but I stopped her and said, "Do it. The 30-minute appointment lasted about 5 minutes. Story 37. I am not a doctor, but my mother is a registered nurse working in postpartum care in the United States. She actively avoids mentioning her career because during cancer treatment, some of her doctors treated her more like a nurse than a woman with breast cancer. When she was diagnosed with a secondary cancer, her oncologist had to be reminded that she was a woman facing a potentially terminal illness. Story 38. Doctor here. 90% of the time, I do not even tell them I am a doctor. They are experts in their own field, so I always respect their knowledge and listen as if I were a regular person. Unless it is my wife who is also a doctor, then I definitely do not listen. Ever. That's what she said. Story 39. He who acts as his own doctor has a fool for a patient. Ostler. I still treat myself for most illnesses, though to be honest, knock on wood, I do not have any chronic conditions. I am also an emergency room doctor, so that may be different for other specialties. When I have had injuries, such as an anterior cruciate ligament injury, it helps the other doctor communicate in our language, which usually speeds things up. If my family is ill, I usually assist with translation but try not to step on the other doctor's toes unless I believe something is awry. Story 40. I am a dentist. Even within my field, I see another dentist for checkups and treatment when necessary. I have not needed major work on my own teeth, but if I did, I would discuss it like a project with my dentist and weigh the options, pros and cons. The thought of someone else drilling in my teeth makes me anxious. You cannot fully assess their manual dexterity until the job is done, so you must trust your choice of dentist. I have deep respect and gratitude for my patients who trust me with their health. It is an honor. Story 41. In 2 words, it is awful. As a medical student, during examinations I was taught and quizzed about what I thought the problem was. Now, 2 years after qualification, I still hate it. In training, you tend to move around a lot, which means little to no continuity with your own healthcare, so I have tried a few approaches. Sometimes I do not say I am a doctor unless I am specifically asked, and I give the clinician a very obvious textbook history so they cannot misdiagnose me. Other times I have tried this and they have not done what I was after, so we had an awkward argument and I had to look up the national guidelines on the internet. Now that I have settled a little, my doctor knows me and generally lets me say which blood tests and other investigations I want, or the suspected diagnosis if I have an idea. Then we agree on what to prescribe or on future management, which is amazing. I hope this helps satisfy your curiosity. Story 42. I am a doctor. I will share my experiences, even though some may disagree. I will not try to sugarcoat anything. There are a few differences. Most notably, access. If I want to see a subspecialist, I text or call them and I am in their clinic the next morning. No waiting, no referral, usually not billed, and often not even documented. If I have questions after the appointment, I usually send a text and receive an answer quickly. When I see other doctors as patients, they get appointments much sooner and have greater access to follow-up and direct communication than non-physician patients. During the visit, things are different. I know the format doctors prefer, so I present my case in that format. The visit moves much faster. Because I have some knowledge going in, the treating doctor often asks for my opinion. Another aspect is that sometimes we do not receive the standard of care, both for good and for bad. For example, when I had surgery a couple of years ago, the standard would have been to wait and see if things improved naturally. Instead, I had a magnetic resonance imaging scan that day and was in the operating room within hours. I also did not follow the typical rehabilitation protocol, such as physical therapy, because my background equipped me to provide my own therapy. It is strange because you are blending aspects of patient-doctor, professional, and often personal relationships into a single visit. The same doctor who is treating me now might have met me for dinner and drinks a week ago. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.